We're going to take you live now to Sydney, where the New South Wales Health Minister and Chief Health Officer are providing an update on the coronavirus.
A 35-year-old gentleman who came on the 6th of January. Another gentleman in his 40s came on the 18th of January. And another gentleman who is 53 came on the 19th of January. Now, each of those gentlemen, I should say, happily, their conditions today are stable in hospital and therefore progressing reasonably well at this time. Yesterday we reported that we had 4 cases that were under investigation. I'm very pleased to be able to say that 2 of those 4 cases have now been cleared, and that's a very positive outcome. It is, though, a moving feast at the moment in terms of the numbers of people coming forward, and so we have at the current time another 3 people who are now under investigation. That gives us a total of 5 people who are currently having their pathology addressed, and we're hopeful that we will get those results this evening sometime. I'm also conscious of the fact that there are a lot of other activities happening at the present time, so today we will be making those announcements, but if we do get any updates in terms of the pathology results, we will immediately make that information available by media release and on the health website. I'm concerned that it may come quite late today or this evening, so rather than holding a press conference, we will deal with it that way. Because matters are being dealt with and managed quite sensibly, quite capably by New South Wales Health. Our public health units are doing extremely well. And I'm just going to ask, before I say anything further, because that was a lot, for the court translator perhaps to actually explain as much as she can of that. Also, could I also explain that because our translator is not medically trained, we have Dr. Zhang, who will just be listening as well. And whilst not absolutely confident in Mandarin, he can certainly pick up the technicalities. So I'm sorry it's going to take a little bit longer, because one of our audiences that we would like to hear this message is the Chinese community. And I'll explain why in one moment. Would you like to explain that as much as you can? I've just been informed there's a wrong date, 20th of January, but the translator will make that.
首先，我们今天想要跟大家更新一下目前在新南威尔士州所发现的新型冠状病毒的一个目前的状况。那么根据我们目前所确认的情况，我们一共有3名男士现在已确认为感染了相应的病毒。那么这3位男性分别是在1月6号，一位35岁的男性抵达悉尼，然后1月18号，一位40多岁的中国男性回到了澳洲。另外呢，就是19号，一位53岁的男性同时抵达了这个澳洲。那么非常幸运的是呢，我们及时发现了这些问题，而且他们目前现在所处的状况比较的稳定。我们将会对他们进行进一步的观测。另外呢，在昨天我们也收到了一些新的报告，其中呢有4例是疑似案例。那么我们在经过进一步的排查之后，现在已经可以确认，其中2例是并不是这种新型感染的病毒，所以他们已经完全解除了这个相应的危险。至于其他的，我们依然还会对它进行进一步的观测。鉴于我们现在整个的情况都是在不断的这个更新过程当中，所以呢，我们其实在今天早晨呢又接收到了3例新的这个报告案例。那么也就是目前我们一共是有5例的案例依然处在这个进一步的观测当中，然后在稍后我们会将相应的这个检查报告予以公布，并且我们将会决定他们是否已经感染了相应的这个新型冠状病毒。我们希望在今天晚些时候能够拿到他们的这个病理检测结果，并且呢我们会通过我们的网站来进行相应的信息公布。那么届时我们可能就没有时间再去进行这个新闻发布的这个过程了。另外呢，我们想要跟大家讲的就是在从这个发现病例到目前，我们在新南威尔士州各个部门的这个总体合作和这个协调一致的工作之下，我们的整个管控工作进行的是非常的顺利的。另外呢，我们今天也请到了这个郑医生，那么他对于相应的这个医学方面的专业知识有着很好的这个理解，所以呢，如果有相应的一些相应的具体医学方面的常识，或者是一些相应更加具有技术性的这个问题，我们也可以由郑医生为我们进行解答。谢谢。
谢谢。So the issue is that all right, Dr. Zhang? Yeah, perfect. Thank you very much. So the issue, particularly for health today, is that we want to make sure that any of our visitors, or indeed Chinese Australians who have been to Wuhan or had any connection with Wuhan or Hebei, or has come into contact with anybody who's been in that area, do take very great care in terms of any symptoms they may have. I stress that symptoms that may present are very flu-like type symptoms, and in order for them to be assured, I can tell them that everybody who has had those symptoms is being well cared for and being dealt with, obviously, with great privacy in terms of their names and addresses. I'll just allow the translator to translate that first.
那么在这里呢，我们也是再一次的呼吁，对于任何的这个相关人士，如果最近你们有从这个武汉以及湖北地区回到这个澳大利亚，或者是您与从这个澳大利亚从武汉来到我们澳大利亚地区的这个相应的这个旅行者，或者是有疑似病例或者是确认病例的人有过直接接触的，我们希望您能够关注自己相应的一些这个症状。那么我们的这个新型冠状病毒，它的主要症状其实在初期是和流感症状比较类似的。那么无论是这个症状是轻还是重，我们都希望大家能够全力的关注一些相应的症状，并且能够及时的采取措施。同时呢，我们也可以向大家保证，那么如果当您在这个向我们上报了您的这个症状之后，你也会得到非常良好的这个照顾和治疗。谢谢。
谢谢。It's important for the Chinese community, Chinese Australians or Chinese visitors, to be aware that the information that they should be listening to is coming from, or should be coming from, official sources, that is from New South Wales Health or through these press conferences. I am concerned that there has been some information that is circulating, particularly through WeChat and other social media platforms, that aren't entirely accurate. And I would stress that there are no centres here in Sydney or no centres across New South Wales where this particular virus has been located. The critical issue is where you have come from. If you've come from Wuhan or Hebei, then you should be alert. And again, it's just a matter to be properly managed and to contact your health provider. If you can do that one too. We've got the number anyway.
那么在此呢，我们想特别的提醒我们的这个华人社区，我们知道最近其实通过一些类似于像微信或者其他的一些中文自媒体平台，我们有很多的消息呢会在这个人们的这个微信平台上进行传播，但是我们希望大家可以尽可能更多的关注。
Authorities in New South Wales, they're providing an update on the current situation in regarding the coronavirus in the state. A short time ago, the Chief Health Officer and the Health Minister of New South Wales confirmed that another 3 people are now under investigation for the deadly coronavirus in New South Wales. Yesterday, it had been confirmed that there were 4 people in New South Wales who were being tested. 2 of those people, though, have now been cleared of the virus. So currently there are 5 people who are under investigation for the virus, but they do state that the 2 men that's still in hospital following yesterday's announcement, they are stable and progressing, and the blood tests of the other 3 further cases will be released later on today.